In this episode, we're going to talk about calcium and why it's not the best supplement to be using for bone health. We're going to talk about what supplements you should be taking to address anxiety, and I'm going to talk to you about why a chiropractic adjustment is important even though you don't hurt. This is the Ask Dr. Daniel DC show. Okay, Juanita asked if her calcium supplement was healthy and how much calcium she should actually be taking to increase bone density. Now, first of all, if your nutritional supplement contains any of the following: maltodextrin, artificial colors, polysorbate 80, titanium dioxide, artificial flavoring, artificial sweeteners, glycerol, or any other weird ingredient that you cannot pronounce, chances are it's not a very good supplement. Oh, and if your vitamin is a gummy, then it's not a vitamin. It's a gummy, which also means it's canned. Now, a little bit of background here. If your goal is to improve calcium absorption, the best time to do so is before you hit your 30s. So women, if you don't want weak bones, you need to do everything you can possibly do to build bone reserves early in life. Not that it's impossible after you're 30, but it's definitely much harder. Just like it's not impossible to save money up in your older years, it's just a little harder and it makes more sense to do it earlier. Now, how do you build bone density? It's not with calcium, at least not by itself. And what most doctors fail to educate their patients on is the fact that you have to optimize vitamin K and vitamin D in order to absorb calcium and then push that calcium into your bones. So you can take all of the calcium supplements in the world, and if your vitamin D and vitamin K levels are not optimal, you're not going to absorb the calcium. Worse, your body will simply stack that calcium in places that you don't like, such as your kidneys. So think of kidney stones, or your arteries, which can contribute actually to calcification of your arteries. So be very, very careful if you're taking calcium supplements. In fact, taking the wrong type of calcium has been shown to increase your risk of heart attack by upwards of 27%. The best type of calcium that we can take is going to be a chelated form of calcium. I personally recommend calcium malate or calcium ascorbate. I would avoid calcium carbonate, oxalate, or oxide, as all of these forms of calcium have been associated with an increased risk of heart disease, cancer, and even hip fracture, which is the whole reason why you're taking calcium in the first place. So what's a woman to do if her bone density shows up abnormal? First, if your bone scan or your DEXA scan was performed using the T-score method and you're in your 30s, that's not an accurate test because the T-score defines normal bone density based on the standard 25-year-old. The Z-score, however, is more accurate because it's based on age. And if your Z-score still tells you that you're osteopenic or osteoporotic, then what you need to do is focus on the following three things. Number one, increase weight-bearing exercise. I'm sure you've heard that as astronauts go up into space, they lose bone density because of the lack of gravity or resistance. Now, this is known as Wolff's Law. And Wolff's Law basically teaches us that any force applied to your body will result in an increase of bone to that area. Also, the opposite is true. As you take away resistance or weight, you'll lose bone density. So by incorporating more weight resistance and exercise, this is one of the ways that you can turn on your bone building power. Number two, you need to decrease acidity in your body. Acidity usually shows up because of a poor diet. Now, part of bone density loss could be due to a highly acidic body. You really need to look at it this way. If your blood is too acidic, your body knows that that's not healthy. So it's going to do everything that it can to buffer that acidity. And one of the best ways to do that is by leaching calcium or releasing calcium from your bones into your bloodstream, thereby neutralizing the acid. So processed foods, sodas, smoking, alcohol, the chemicals found in consumer products, the chemicals found in your cosmetic products, all that needs to go or needs to at least be checked. Likewise, you need to increase alkalinity. So increase your greens. That's one of the best ways that you can do that. Green lettuce, kale, broccoli, spinach. These are all very, very important for increasing your alkalinity, as well as it's the best way to get your calcium. Number three, get your vitamin K and vitamin D levels checked and work on optimizing them. Four, finally, I would never consume more than 1,200 milligrams of calcium daily in the form of a supplement. So if you're trying to get your calcium in through a pill, it's just not going to be healthy for you, and I would not go over 1,200 milligrams. I would just get it through your diet. That's really the best thing you can do. Next question comes from Nikki. And Nikki is asking, what are the best supplements for anxiety? Now, this is actually a very common question that I get, and the reason is because everybody wants to know what supplements they can help to improve their brain or to help them feel better, right? It's such an important thing. And the reality is we shouldn't approach this question with supplements first, because failing to address the root cause of your anxiety or depression will only allow things to get worse, and the supplement will only be treating the symptom, just like a medication. So if we're talking about anxiety specifically, we need to address the cause of anxiety. This, of course, can be either due to internal factors or external factors, or both. Anxiety can be the result of many factors, from work, kids, significant others, worldly events or situations, etc. And your body responds to stress by releasing hormones, primarily cortisol, from your adrenal glands. Now, cortisol is an important mediator of the stress response, and it's also important for things such as regulating blood sugar, electrolyte balance, as well as hormone balance. Our bodies were obviously designed to respond to a stressful event and then return back to a baseline state. But when stressful events occur back to back or stressful triggers last, the stress response becomes downregulated and our bodies eventually reduce the amount of cortisol. This is where we start to feel fatigued. Though too much cortisol can cause damage to your body, too little is also a problem. On top of cortisol, there are also neurotransmitters or brain chemicals such as epinephrine, norepinephrine, dopamine, serotonin, and GABA that help to regulate mood, that help to manage stressful situations. So again, these compounds are very important for regulating mood and cognition, sleep, and much more. And when these chemicals become imbalanced, then you're going to feel either a heightened or diminished sense of vigor, vitality, you'll feel fatigue, or even anxiety. Now, all that said, the root cause of the problem is always, again, the most important to address. So I don't like to guess, I like to test. And there are tests that you can do to see if your brain chemistry is out of balance. And if it is, then you can have more targeted approaches to actually treating it because you know specifically what compounds you need to address. Additionally, say you get the test done and you found out that you don't have any imbalances or that your chemistry is normal, but you still have these symptoms, that would point to more cognitive behavioral or external factors that need to be worked on. So things like psychosocial therapy or cognitive behavioral therapy would be very important to start off first. Okay, so what are the best supplements for anxiety? I'm going to give you 3 herbs and then I'm going to give you 3 vitamins, minerals. The first is kava. Kava is probably the most studied and most effective solution for anxiety. It is clinically known to drop blood pressure, relax blood vessels, and promote calmness. And while it's the best for anxiety, it also comes with a lot of side effects, such as possible liver damage. So don't take it all the time. Again, we want to figure out what's causing your anxiety and address that. Second on the list is going to be passion flower. Passion flower is also good for addressing anxiety, but not as potent as kava, and that also means that it's not going to have as many side effects. Last but not least, there is valerian root. Again, valerian root is not as powerful as kava or passion flower, but also safer. And most people will actually take valerian root to help them sleep better. So I'm going to say that you're going to benefit more from it by taking it at night. Now, those are 3 herbs that are going to be your best bet for treating anxiety. On to vitamins and minerals. The 3 vitamins and minerals that I would recommend for anxiety is number 1, magnesium. Magnesium has over 600 biochemical reactions in the body. It is one of the leading deficiencies in both men and women and can be the cause of blood vessel constriction, which would also decrease oxygen or blood flow in the body as well as your brain. That said, if you increase your blood levels and your tissue levels of magnesium, it can also result in a state of relaxation because it is your body's natural relaxation mineral. Number 2, B vitamins. B vitamins are very important for nervous system health. They're essential for nerve integrity. The most important B vitamin for anxiety would be B12. But if you're going to be supplementing with B12, make sure you're taking the healthy form, which is methylcobalamin, and not the synthetic form, cyanocobalamin, because the synthetic form won't give you the same effect. Third is going to be 5-HTP. 5-HTP, or tryptophan, is an amino acid that plays an important role in the production of serotonin. Now, taking 5-HTP at night before bed will help you to build your levels up while your brain is repairing and while you're sleeping. So those would be the best bet in terms of trying to address anxiety. Okay, last question comes from Sebastian, who is actually a pediatric patient of mine at my chiropractic office in Austin, Texas. Now, Sebi asked, why do I need to continue getting chiropractic adjustments even though I'm healthy? Sebi, that is a great question. And the first thing that I want to say is that you are healthy because of the things that you are currently doing. So to be blunt, keep doing everything that you're doing to maintain your health. And that includes your chiropractic adjustments. You see, the most important thing for us to realize when it comes to health is that you don't just get healthy. You have to do health. Basically what I mean by this is that you have to do the things that are required to be healthy, right? So you have to do healthy things in order to achieve it. Similarly, you don't just get sick. You have to do sick. Again, what I'm referring to here is that you have to do things that are unhealthy in order for you to actually get sick. Now, why is a chiropractic adjustment important even though you're healthy or you're out of pain? The answer really lies in what controls all function and healing of your body. So to answer that, I'm going to ask you, what is the most important organ for controlling health and healing in your body? Some people will say that it's the heart, and that's really not the answer, because your body will still work when you take the heart out and replace it with another one. The most important organ for your body when it comes to health is your brain. And that is a fact. It's not a belief. It's a medical fact that your brain is the master controller of everything. Sure, eating healthy is important. Exercising is important. Praying to your God is important. But what good is all of that if you cannot process that information? And that is why your brain is so vital to your health. Your brain communicates with your body through the spinal cord and the nerves that exit out of your spine. Your brain sends healing messages to over 70 trillion cells that make up you. Therefore, these healing messages bathe your organs with vital information necessary for life and necessary for daily repair. If you were to interrupt those messages, your body is no longer producing health, but disease because it's not sending those messages. We adjust the spine to make sure that this information is not being interrupted. Now, the two most important indicators of an unhealthy spine and therefore an unhealthy spinal cord and brain is lack of motion and abnormal alignment, which are the reasons why we adjust the spine. So if your spine is the gateway between your brain and your body, and your brain is the center of health, how often would you want to make sure that the brain is able to send those messages to your whole body? Would you want maybe just once a year? Would you do it 3 times a year? Would you do it only when you hurt? Of course not. I would personally want it checked as often as possible so that way I can ensure that my body is able to function at its best as often as possible. Not once a year, not 3 times a month, but every day. So health is about how you are healing, not necessarily how you're feeling. Health is not about sickness or pain, but about your brain. So take care of your brain every single day and make sure that you are allowing those messages to go from your brain to your body as often as possible, and you do that with your chiropractic adjustments. So Sebi, I'll see you at your next visit. Okay, that does it for episode number 8. I hope you guys found the information useful. If you have not done so already, please subscribe to this channel. That's the only way that we grow, and it's also the only way that I can really ensure that as many people are getting this information as possible. If you have questions, you can submit your question via email to info@drdaniel.com. Just use the hashtag AskDrDanielDC so that way I know that you're actually asking it for the show. If you have not done so, please friend me on Facebook at /DrDanielDC. You can also follow me on Instagram at DrDanielDC. You can Snapchat me, look me up. My username is DrDanielDC. And if you're on Twitter, then look me up at AskDrDanielDC. Use the hashtag AskDrDanielDC for any questions. I'm glad you guys are watching. We'll see you at the next show.